welcome Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And today I'm chatting with one of our speakers from the upcoming Gold Midwifery online conference of 2022. Debby Gould is with me here. Debby, welcome.
Thanks, Kristen. Good morning to you.
It is so lovely to have you here today, and thank you for your time here with us today. Now, first, before we get into talking about the presentation you will have here with us titled Exploring Paradigms Around Consent and Birth Trauma, tell our viewers a little bit about yourself. First of all, where in the world are you?
So I'm in Australia, in Queensland, Brisbane, so halfway up Australia, so pretty warm at the moment.
Absolutely fascinating. And if we talked about this earlier when we had a little chat off camera. It is so wonderful to meet with like-minded birth professionals from all around the world, right? And learn together in this kind of format here at Gold, and learn together, learn from each other, and learn from experts like you, Debby. So thank you for joining us here and doing this. So first of all, before we go into the presentation, tell us a little bit about yourself. You have an impressive background. You're an author and, of course, a birth worker. So tell us a little bit about yourself.
Well, I've been working around birth for a bit over 20 years. Before that, I was a registered nurse, but then I moved into midwifery. And then I really started specialising and supporting families to have positive birth experiences, and a huge role in supporting people who had negative birth experiences to heal, because unfortunately it became evident that there was lots of them. And so I've been in that area. That's what I've written the book about. It's called How to Heal a Bad Birth, Making Sense, Making Peace and Moving On. But I'm also moving into the area of and have all along of really wanting to support health professionals to have a better understanding and being able to feel that they can do really positive things, because they're in a crucial space. So midwives and doulas and anyone working with women birthing.
Absolutely, and that's wonderful. Yeah, that you're doing this. You're helping the families work through a bad experience that they had, and with your books and trainings and so on, and now focusing on birth professionals in the field, how they can assist, how they can serve their families better. Because I believe, and I think you believe that too, all of us who work in birth, we're doing that because it's our calling, right? It's not just a job, and we want our families to have a wonderful experience and birth. So we're passionate about this too. And but even then things can happen that we can improve upon. So it is important to kind of revisit from time to time how we practice and learn and listen to stories, to professionals like you.
And not to be overwhelmed, because there's a lot of systematic issues and cultural issues, and it can feel a little bit, what can I do, in this one-on-one, but a sort of interventional moment, a positive moment with a health professional where they're really conscious of what they're doing can actually be really, really powerful in how that experience is going to impact the woman. So even at that micro level, you can make a huge difference, and then hopefully it'll ripple further out.
Oh, yeah, absolutely. And you will be talking about the title of your presentation is Exploring Paradigms Around Consent and Birth Trauma. Consent, when I saw that, when I looked at a little bit the topic of your presentation here, I'm very excited about, I'm a midwife here in South Florida. Recently in our statutes, it was included that consent is, of course, a very big part of our practice, and also that we're now asking for permission for vaginal exams, not only in writing beforehand when we hand out, and explaining things, but also before each and every time, we ask for permission and educate there. And I think many of midwives in the field here have done incredible work. And what I hear from my, especially the out of hospital midwives colleagues here a lot is, they're trying so hard. They're doing all these, really working hard, working with the families, want to make sure that they don't cause any trauma and make sure that the birth is so positive. And then there comes maybe a situation when continuing the birth at a hospital is maybe more appropriate. So it comes maybe to a transport or transfer. And then all of a sudden, everything goes to hell in a handbasket, because all of a sudden, there's different procedures, different care providers, communication is difficult. And there is, do you hear about this a lot in your area?
I think so. Definitely that happens, and for the health professional, it can be quite traumatizing for them too, and they can feel very powerless in that situation. But I think with the talk as well, be looking at even clients in that scenario, if they've got somebody there almost counteracting that to a point, often they'll still come out a lot less impacted than if they didn't. So there's still, even if it can't be exactly how we'd like, it's really good to explore what we can do to minimize damage, and then to also empower around that, so that in that scenario, for example, that the client, the woman, the family come out of it perhaps annoyed at the particular health professionals who weren't providing respectful care, but beyond that, feeling quite still positive and confident going into parenthood, rather than having their whole world shattered and being negatively impacted in their lives going forward. So, but I think with birth trauma, it's really important that we look at trying to identify it, because I think for health professionals that can be really challenging, because it's in the eye of the beholder, and so what may appear, we might think seems traumatic, might be quite different to the woman's experience, and that can be a bit confusing for health professionals of, should I be worried here, shouldn't I be worried here? And so we'll be looking at things around that, and what we can do to mitigate damage and promote empowerment.
Absolutely. And you're so right. It is also, you brought up something very important there, in the eye of the beholder, right? I remember it's in a birth when I was a student, and to me it looked like this a first-time mom, a little longer labor, and birthed in the tub, and friends were there playing music, guitar and all that, and to me it looked like a very, as a student, from like a peaceful experience. And then later I was kind of really shocked to hear when she was in the waiting room, and she described her birth postpartum visit to other mothers, because they had a little group going, and all these other pregnant moms asked her, so how was your birth? And she was saying, oh my gosh, it was horrible. And I was sitting, overheard this, and I'm going like, oh my gosh. So to this poor mother, her experiences was not good. And to me, it looked like, oh yeah, she's having a positive birth with all these, warm and fuzzies. But to her, it didn't feel like that. And I felt like we were failing at at this experience. We were like, what did we do wrong? How can we do this better? How can we not have seen this? How that felt to her? And I was I was really questioning everything I was doing at that point. And it was a big moment, aha moment for me, to saying, okay, what I see and experience is not necessarily what the family sees and experiences, right?
And what we will be exploring is some keys to give you more insight into that, and to have a better chance of being able to identify that during the birth and after. And there'll always be opportunities where maybe something was missed, but that you can reflect back on that and say, okay, I didn't realize that was happening for you. We can certainly mitigate the damage, but really wanting to provide the midwives and the birth workers with real insight and keys to be able to figure that out, basically, and work with women around it, rather than be totally shocked, assuming one thing and then finding out it was quite different. But I think it's also important with the eye of the beholder thing, that sometimes I get the impression, not often, but that it could be portrayed that, it's up to the woman. One woman may perceive the same thing this way, that way, but which makes it sound like perhaps it's a resilience thing with the woman. But I can tell you that it's when you learn those keys and you look at it, you think anybody in that scenario with that level of vulnerability that she was experiencing, feeling like that, would be traumatized. So it's not just
Right.
so it's really important for us to get some insights and get some help around identifying it.
Yes, and that's why we are so honored to have you here and presenting on this topic. This is absolutely wonderful. So before I let you go, what are your hopes that viewers of your presentation will take away from the presentation there?
Well, as I was just saying, I hope they can take away some confidence in being able to go, okay, I can identify women who have had negative experiences, but even more because of that, I'm going to be able to help reduce them. And then particularly around consent, this is going to be, consent is a little moment or several little moments over an episode of care of time that are sanctioned. They're approved by everyone. Thinks it's important, the clients, the health professionals, legally the institutions. So if we can get some real good patterns happening around consent, which will be allowable because everybody thinks it's important time-wise,
right?
That could then possibly, we can see the positive effect of that, and it can possibly ripple out and start to change the culture across the episode of care. But consent's a really great little microcosm to work on.
Wonderful. Well, thank you so much. And before I let you go, I know you are working with healthcare professionals as well. Tell our viewers how they can reach you. Do you have a website? How can they contact you?
Yeah, sure. So they can reach me. Probably the easiest way is birthtalk.org. So www.birthtalk.org. And then my details are all there, so they can reach out via Zoom, via email, via online.
Beautiful.
Forums.
Thank you so much, Debbie, for talking about the amazing work you're doing and the presentation. We are so looking forward to your presentation here at Gould.
Okay, thank you very much for having me.
Thank you. And for our viewers, if you are interested in this presentation, you want to find out more and also about all the other presentations, we invite you to visit gouldmidwifery.com. This particular presentation will be live on February 15th, but all the presentations that are live will also be recorded. So if you can't make it to the live, so if you are at work or catching a baby somewhere, you will be able to watch the recording. So don't forget to check it out. And I hope to see you all at the conference. Bye-bye, everyone.